Yeah, for sure. And there's a lot of fear around it. So, and I have to preface this with I'm going to talk about the way I do things. And there's a reason that I am not like in the conventional setting, in the conventional insurance-based setting. I've kind of set off on my own. And I think there's probably like with in every different type of health practice, there's, really good therapists and not so good. So I'll talk about the way I do it and what I think is should be best practice. But for pelvic floor physical therapy, usually, if someone wants to come in for an evaluation, we do intake paperwork, and I'll chat with them on the phone first for a good 15, 20 minutes to see what and what the problem is, what they need, and we'll talk about if they want an internal exam. So that is usually what sets pelvic PT apart in one of the ways is that an intravaginal exam. So, that is meant to, I insert a glove finger to assess like the tone, strength, and just like muscle length, how they're functioning of the muscles of the pelvic floor. And that can be extremely beneficial for a lot of people, but it's not something that I have to do or that, it's always number one is is patient comfort. I've helped a lot of people virtually and just without doing an internal exam, but I do think that's a good part of it. So we talk through that, the pros, cons, if that's something that they want in the exam. And if not, then usually first session, we'll just do external. And that's going to look like, long subjective history. I like to get the full story of if someone's coming in for a specific complaint, what's going on, why, pain levels, how long it's been, what could be contributing to it. And then, if it's just more prevention for pregnancy, we're talking more goals and everything. And then the full exam, like I said, it does depend on what they're coming in for. But based on that, I'll do a full external exam where I'll assess kind of the whole chain. It's not just, a lot of people think pelvic floor PT, it's just like look at the hips and the pelvic floor. And, that's not the case. And I think you can attest to that too as like a chiropractor and, holistic practitioner that there's lots of things that affect an injury or an area or pain. So we're looking at those areas as well. But we'll do a full exam. Then after that, get right into some treatment or some exercises, therapy, something that's going to hopefully help make a difference in session, and then talk about the long-term plan, but hopefully be able to come up with kind of what's going on and why, so that we can make a good plan together.